morning. On behalf of West Health and the University of Rochester, welcome to the 4th Annual d.health Summit. Every generation confronts great social challenges. Rochester has been on the front lines of addressing many of these challenges, including abolition through the work of Mr. Frederick Douglass, and women's rights, including through the work of Ms. Susan B. Anthony. Following the vision of Ms. Susan B. Anthony, half of today's speakers are women. Today we address one of the great challenges of our time, aging. That challenge is a consequence of the most amazing accomplishment of the 20th century, a near doubling of life expectancy. For all of recorded human history, life expectancy for humans has never been more than 35 to 40 years until 1900. Fueled by advances in public health and medicine, life expectancy increased by at least 30 years throughout the world. The result is an unprecedented number of seniors. To help us prepare, we've assembled all of you, leaders in health, policy, technology, and finance, to exchange ideas, create novel partnerships, and foster disruptive care models. Dr. Christine Castle, a pioneering and prescient geriatrician, will deliver our opening keynote address. 25 years ago, she and her colleagues saw that gains in life expectancy would come with increasing morbidity. They said, and I quote, "More attention must be given to ameliorating the non-fatal diseases of aging." They were right. From 1990 to 2015, the number of individuals with Parkinson's disease globally has doubled to over 6 million. And by 2040, it will double again to over 12 million. If Parkinson's disease were infectious, we would call it a pandemic. We can prevent this pandemic for some and improve care and treatment for nearly all. In planning this year's summit, we could think of no better place to be than Boston. According to the Milken Institute, Boston is one of the top cities for aging because it's outlined by Harvard's Dr. Joe Kvedar in his book, The New Mobile Age. Boston helps older adults maintain a sense of purpose, develop social connections, and exercise. Before lunch, our co-host, West Health, will share insights from yesterday's visioning session at Fenway Park. Led by Ms. Shelley Lyford, West Health enables seniors to age in place, or in the words of Dr. Charlotte Yeh, to thrive in motion. Since 2006, West Health has given more than 400 grants totaling nearly $200 million. Last month, West Health announced the accreditation of the Gary and Mary West Emergency Department at UC San Diego, the first accredited geriatric emergency department in California. This afternoon, Mr. Jody Holtzman and his colleagues will discuss how data can lead to better outcomes for the longevity economy. Those over 50 account for most of this country's net worth, consumer spending among adults, and charitable giving. Afterwards, in a panel moderated by longtime Wall Street Journal reporter Ms. Laura Landreau, we're going to learn about disruptive care models from the leaders of American Well, Call 9, WellBe Health, and MIT's Age Lab. These disruptive care models include telemedicine. Thanks to the Greater Rochester Health Foundation and the Safra Foundation, we now use video visits to care for anyone in New York with Parkinson's disease. For the first time, individuals with Parkinson's disease can receive expert care in their home, regardless of who they are, where they live, or their ability to pay. 250 New Yorkers and counting receive such care. Their average age is over 70, 59% live in health professional shortage areas, and 20% are homebound. Dr. Troy Brennan, the Chief Medical Officer of CVS Health, will give our closing keynote address. Healthcare is moving from hospitals and clinics to homes and mobile devices. This migration mirrors what's occurred in banking, where banking has moved from banks and ATMs to banking at home and mobile banking. No organization may be better prepared for this migration in health than CVS Health, which is located within 10 miles of over 80% of the US population. And no one is better prepared to lead this effort than Dr. Troy Brennan. During our breaks and lunch, we will learn from innovative exhibitors who are seeking to improve aging, The d.health Summit would not be possible without our outstanding advisory board, including Senator Tom Daschle, Ms. Krista Drobak, Dr. Terry Fulmer, Dr. Daniel Carlin, Mr. David Klein, Dr. Joe Kavadar, Dr. Stephen Landers, Mr. Tim Lash, Ms. Lindsay Conner-Mosby, Dr. Bruce Leff, and Dr. Charlotte Ye. Could you all please stand to be thanked for your service? The summit also would not be possible without generous sponsors and media partners. If you're from Pfizer, Biogen, the Hartford Foundation, the Simon School of Business, V&A Health Group, American Well, Acadia Pharmaceuticals, or one of our outstanding media partners, please stand to be recognized. Finally, absolutely none of this would be possible without an outstanding team. Please join me in thanking Shelley Lyford, Tim Lash, Diana Campow, and Aaron Bateman from West Health, Monica Perino and Brian Ingram from our marketing partner Brand and Butter, and Anna Stevenson, Donna Moskowitz, Jean Paco, Alistair Glidden, Chris Snyder, Kelsey Spear, and many others from the University of Rochester. I am now delighted to welcome the President and CEO of West Health and our partner and co-host, Ms. Shelley Lyford.
Right, well, good morning, everyone, and welcome to Boston. Ray, Avi, thank you so much for this great opportunity to co-sponsor the d.health Summit. We're in our second year together. It's been a great experience, and of course, it was amazing to be at Fenway Park last night. Did any of you go to the game last night? Very happy to report the Red Sox won, so that was great. So it's wonderful to be here in Boston for a multitude of reasons. But really, when I think about the d.health Summit, and I think about being in a place that is so focused on the revolutionary spirit, it seems to me that Avi and Ray hit it just right with picking this location as we move beyond healthcare to successful aging, which is truly going to take a revolution. Boston has personified the revolutionary spirit ever since the Battle of Bunker Hill in June of 1775. And as many of you know, I am from Vermont, and as a very proud Vermonter, I'd like to point out that Ethan Allen and his Green Mountain Boys, a month before, in May of 1775, were very successful in defending Fort Ticonderoga against the Redcoats. But today, let's go ahead and tip our cap to the very first Boston Patriots. And while we're at it, we can probably tip our cap to our current our current New England Patriots, of course, led by Tom Brady. So, more than 2 centuries after a band of Massachusetts militiamen began the struggle for a new and better world, the same forward-looking spirit of reinvention is driving the much-needed change in healthcare. Innovators, entrepreneurs, and scientists are pushing the boundaries of biomedicine and biotechnology. Researchers at universities and industry labs across this great city are sweeping aside outdated care models, and together with the people in this room, we are reimagining the future of healthcare in America. And this comes not a moment too soon. We have been far too complacent in the face of a historic demographic shift that presents enormous challenges to enabling successful aging. Baby boomers are rapidly becoming grandparents. Every day, more than 10,000 people in America are turning 65, and by 2030, which is just 12 years from now, 1/5 of our population will be 65 years or older. And let's face it, our current healthcare system is not structured or scaled to take care of today's seniors, let alone tomorrow's. And meanwhile, the so-called safety nets of Medicare and Medicaid are badly frayed. All of us saw in the news yesterday what happened with Medicare. And tragically, it is the oldest and the most vulnerable among us who are paying the price, namely seniors living at or below the poverty level. A recent West Health-sponsored survey revealed that 40% of Americans are more anxious about the medical bills from a serious illness than having the serious illness itself. Think about that for a moment. What kind of country have we become when medical bills are scarier than actually having a life-threatening disease? Perhaps it is a country that is ready for an uprising. Every revolution involves disruption, and with disruption comes opportunity. The opportunity to innovate, the opportunity to reinvent, to create new models, new systems, and new businesses. West Health is dedicated to transforming healthcare in this country to enable seniors to successfully age in place, or Charlotte, to successfully age with motion, thrive with motion. And at the same time, we want to assure that our seniors have access to high-quality, affordable health care and supportive services. But West Health isn't sounding the alarm, like Paul Revere, about this looming public health crisis that is facing seniors. Through the Gary and Mary West Foundation, we are investing in innovative, senior-friendly models of care. At the West Health Institute, we're conducting applied medical research and promoting best practices to encourage the broader adoption of these models. And at the West Health Policy Center in Washington, D.C., we are translating research into practice and practice into actionable policy. Today, we have gathered to explore strategies for revolutionary change. And believe me, radical change is what we need, because let's face it, if we're not in our 60s yet, we are soon going to be. And as Ray pointed out so aptly earlier this morning, as well as yesterday at our pre-session, we are likely going to be spending many more years in our old age than our parents or our grandparents did, thanks to the medical innovations of the past few decades, which have terrifically extended life expectancy for all of us. But longevity in and of itself isn't the goal. What all of us want is quality of life in our old age, what West Health calls successful aging. We need to re-examine and reinvent the ways we deliver care and leverage technology, how we pay for services, how we drive practice and policy. And really, we just need to rethink about the way we age itself. What seniors desperately need and what we all must dedicate ourselves to is nothing less than a new standard of care for successful aging. So every revolution, including this healthcare revolution, needs a manifesto that charts the way forward to a better future. So in the spirit of Martin Luther, who 500 years ago, in 1517, posted his thesis for reform on the door of Castle Church in Wittenberg, I would like to declare 3 non-negotiable actions for successful aging. First, let's start with what seniors want. It sounds self-evident, doesn't it? But all too often, systems are designed to serve the interests of providers or insurers or the health systems, instead of patients or seniors themselves. Boston-based luminary Dr. Atul Gawande has been leading the charge around what matters most for years, and we are grateful for his leadership. Whether we're designing a senior dental clinic or a geriatric emergency department, West Health always begins by asking seniors and their caregivers, what is important to you? What matters most to you? And what they overwhelmingly express is the desire to age in place and to have services easily accessible to where they live. And home means something different to almost every different person. It could be a plush, independent living facility, or it could be a single room occupancy, or something in the middle. Regardless, it is still home, and we need to be ready to provide care wherever that may be. Enabling successful aging goes beyond delivering health care and well beyond the 4 walls of a hospital. What seniors want and need is life care that encompasses community supports, nutrition, wellness, senior-friendly transportation, and other social services that enrich the aging experience. It's time we expand the horizons of healthcare to meet seniors where they live, to deliver integrated and coordinated care when and where they need it. Point number 2, let's tailor technology to serve seniors. Healthcare technology is crucial to enabling seniors to age in place with autonomy and independence, whether through wearable medical alerts, patches, telehealth, tech-assisted meal delivery, robots, mobile emergency care units, or the like. And of course, biotechnology defines the cutting edge of innovative therapies to improve quality of life and longevity. To the technologists here today, I challenge you to focus your energies on serving the needs of seniors, including creating technology that will connect the housebound seniors to the wider community that they love so much. And number 3, we need to empower seniors with affordable, accessible, and transparent health care. Simply put, healthcare has become unaffordable in America. We must accelerate the movement to value-based systems of care and payment, particularly for seniors who often have the highest medical needs. Far too many seniors have to choose whether to use their limited resources to pay for food, for rent, or for medicine. No matter how innovative our new delivery systems or technologies may be, they will only add value to seniors if they are more cost-efficient than our current models, and they must deliver better outcomes. And let's face it, Medicare's budget is likely to contract, not expand, particularly as more Americans turn 65, which means we are going to have to stretch Medicare dollars to the maximum. We can start by creating a value-based treatment and payment model that actually rewards improved outcomes over increased volumes. It is time to align incentives. Pricing transparency is another way to lower costs. Hiding prices behind walls of secrecy encourages price gouging, regardless of who is footing the bill. Every year, millions of middle-class Americans are driven into bankruptcy because they don't know the cost of treatment until after it's been administered. It's like going to a restaurant, having somebody else order for you from a menu with no prices, and then you're delivered the bill weeks later. And we all understand how important the issue of pricing of drugs is. We must lower the cost of prescription drugs. New and improved medications are a blessing for those who can afford them. For everyone else, they're a taunting reminder of the health disparities that mirror the income disparities in this country. And while we're on the topic of drug pricing, I would love for someone in this room to explain the logic to me of why the Veterans Administration and Medicaid can negotiate the prices of drugs for their constituents, but Medicare cannot negotiate the price of drugs for seniors. Seniors, the fastest growing demographic in this country. It seems to me that Big Pharma's profit motive is much more powerful than its desire to serve America's seniors. I can't think of a better place to fuel the healthcare revolution than by changing this very misguided law. The healthcare revolution calls for bold, coordinated action. It is driven by technology and innovation. It demands inspired leadership and dynamic partnerships. It requires entrepreneurial zeal and creative acts of reinvention. And it is being led by visionaries in medicine, science, business, and philanthropy. Visionaries like all of you. On behalf of West Health and the University of Rochester, thank you for being here today, and thank you for your commitment to revolutionary change.